My subfield report is on clinical and counseling psychology. You can often find these two paired together because they have so many similarities, but they also have differences that are very distinct that set them apart. Both clinical and counseling psychology focus on human functioning, but so do many other subfields of psychology. So what sets these two apart is that they're more focused on the improvement of human functioning. Clinical psychology focuses on improving problems with mental disorders and developing a treatment plan for patients who have mental disorders or behavioral disorders. Counseling psychology focuses on problems that affect a patient's daily life and providing a treatment plan that helps to restore a daily routine. As far as education, for a person planning to pursue a career in clinical or counseling psychology would need to start by obtaining a bachelor's degree in psychology. Depending on career choice, the next step would be graduate school. For graduate school, you have three options. You can obtain a master's degree, a PhD, or a PsyD. A master's degree, you're going to have more limited options to what careers you can pursue. With a PhD, it is going to be more research-based if you're interested in conducting research. A PsyD is going to be more applied learning if you're interested in being a practicing counselor or clinician. In addition to completing a bachelor's degree and a doctorate degree, a person wishing to pursue a career in clinical or counseling psychology will also need to be certified in the state in which they wish to practice in. Individuals will also need to complete a pre-doctoral internship as well as postdoctoral training throughout the years of practicing. Like previously stated, individuals who obtain a master's degree will have more limited options, and if they choose to practice, they do have to practice under someone who holds a doctorate and is licensed to be a clinician or counselor. There are several different jobs available to those who pursue a career in psychology based on the level of education obtained. For those who only obtain a bachelor's degree in psychology are more limited to their options. But there are still some careers in clinical and counseling psychology for those with bachelor's degrees. One includes a mental health aide. A mental health aide assists patients in a mental health facility with activities throughout their daily life. For those with a master's degree in clinical and counseling psychology still have limited options, but more than those bachelor's degree. Some of which include a research assistant, which obviously is a person who is assisting a researcher who has a doctorate degree. Another would be a community college professor, which would be an individual who is teaching psychology courses at a community college. Those who obtain their doctorate degree have a few more options than those with only a bachelor's degree or a master's degree. One of those would be a college or a university professor or researcher. Another would be a counseling psychologist or a child psychologist. A clinical child psychologist assesses mental, behavioral, cognitive, and psychological issues in children from infants to adolescents. And based on a patient's need, they develop and provide a treatment plan. To be a clinical child psychologist, obviously an individual would need to be able to work well with children of all ages, be able to assess and evaluate patients, and apply relevant research to the patient's needs. I chose clinical and counseling psychology as my subfield because that's what interests me the most, mainly clinical psychology, and I want to be a child psychologist. After I complete my bachelor's degree at Spring Hill, I plan to take a gap year and then attend a graduate school to obtain my PsyD in clinical psychology to become a child psychologist. I currently work at a preschool and have for the past 4 years, so I consider myself to work very well with children as well as communicating and connecting with their parents very effectively. And I have a strong love for working with children. After taking abnormal psychology, I also developed a very strong interest in the mental health side of psychology. I enjoyed learning about the diagnostic criteria of all the mental health disorders as well as behavioral issues.